manage a lot of metabolic patients. Now, under the umbrella of metabolic is everything. So whether you're talking about neurologic disorders, whether you're talking about psychological, psychiatric disorders, whether you're talking about cardiovascular disease or obesity or fatty liver disease or, whatever, those are all metabolic. Everything, PCOS, PMOS, it's going to take me a while to get used to saying that.
I got to look that up.
Is metabolic. Endometriosis is metabolic. PMS is metabolic. Like all of these things are metabolic. We like to subcompartmentalize. Oh, this is psychology, or this is gynecologic. This is hormones. Well, how are those hormones produced? And how are they processed by your cells? And how do they activate the genome? And oh wait, that's all metabolism. And they all require the mitochondria to actually shuttle these little things across through the cytoplasm of the cell and get it into the nucleus of the cell, into the DNA. Oh, hey, that's metabolic. So everything is metabolic. So you can almost put you could almost put metabolic medicine at the top of everything that is medicine, because everything that happens inside the cell is metabolic. Everything that happens in every organ is metabolic. And people misconstrue. They think, oh, metabolic has to do with metabolic rate. It has to do with energy production. It has to do with weight gain or weight loss. And that's what people assume metabolic is. Mm-hmm. But if you pull back and you actually look at it from a biochemical standpoint, from a physiology standpoint, what is metabolic? Everything that happens inside of your body is a metabolic process that impacts metabolism, because metabolism is every single metabolic process that's taking place every second of every day of your life. And so what medical condition, what symptom is not metabolic? Not a one. Other than, if you have some, genetic, defect that you're born with, like a tetralogy of Fallot or, coarctation of the aorta, like you have something that you were born, trisomy 21, right? Not metabolic. You can't change that. We can surgically change that. You can have procedures, like cardiovascular procedures and things, but ultimately, every chronic medical disease, every chronic medical condition, which includes every symptom, which is basically, the onset to any medical condition, is metabolic. And so this parsing off into, oh, this is hormones, oh, this is thyroid, oh, this is nutritional, oh, this is, it's like all under the same umbrella. So and all impacted by everything, impacted by your dietary choices, impacted by your stress and stress load and stress management techniques and what you choose to do to address it, impacted by your sleep quality and how well you're sleeping at night or not sleeping at night, and what your circadian rhythm looks like and how much sunlight you get and all these other things, impacted by toxin exposures, impacted by exercise activities. And do you over-exercise? Do you under-exercise? Do you do the right exercise? It's like all of this impacts every single cellular process inside of your body, every moment of every day. So all metabolic.
So when you say all metabolic, you understand that terminology, but how would you break it down for the general population? Meaning break it down. I hate to say dumb it down, but the metabolic term.
It's broken down into silos, into individual topics. And it's not discussing it, okay, this is a metabolic condition. It is discussing, okay, what is PMOS? Or what is PMS or PMDD? What is autoimmune thyroiditis versus, subclinical hypothyroid versus hypothyroid due to iodine deficiency? Or yes, it's a discussion on thyroid, the condition of hypothyroid, and what are the causes? What are the lab evaluations for it? How do we come to that conclusion and identify it? But then ultimately, the metabolic side is, what are all the components that are actually affecting it? It's not just, oh, you need levothyroxine, you need liothyronine, you need armour thyroid, you need some supplement that contains, thyrotropin, or it's what ultimately affects everything. So there's actually data on PubMed on inositol for autoimmune thyroiditis and hypothyroid, and it's been shown to actually improve TSH levels. It may improve thyroid hormone levels themselves. It leads to symptomatic improvement. Well, how does inositol come into play in the topic of hypothyroid, and or even hyperthyroid from an autoimmune perspective. So, well, that's the understanding the metabolic processes that take place that lead to that. Or what's the importance of B vitamins or vitamin A or vitamin D or zinc or selenium or iron in thyroid hormone production and function and the conversion of the hormones? Well, that's metabolic. But it doesn't you don't discuss it as metabolic. Really, the more important component is me understanding the processes. So when I say it's all metabolic, that's because that's what's in here. Mm-hmm. How do I see it? How do I view it? How am I going to manage it? I don't say to my patients, well, this is metabolic, mm-hmm. right? Like that's not how the communication goes. Mm-hmm. You should come see me because I'm a metabolic health expert and I can treat these conditions for you. It's like, no, we manage and evaluate people with thyroid hormone disorders, or we evaluate women with sexual hormone imbalances and deficiencies or whatnot. We evaluate and manage people with cardiometabolic conditions like high blood pressure, obesity, fatty liver disease, whatever. So it's not, I don't communicate it as, well, this is metabolic, this is our wheelhouse, this is my playground. It's communicated as, yes, we manage that, we evaluate that, we can help you improve with that. The approach is a metabolic medical approach because that is ultimately, now I could take that, I can flip that and say, well, that's functional, all right? Mm-hmm. Well, what happens in every cell of your body everywhere? Function, right? So, the founding of functional medicine, was based on that term, the naming, I should say, of functional medicine, was based on functionality at the cellular, subcellular level. It was not, and I remember, Jeff talking about it once at a conference. I think it was one of the AICs back several years ago, and he said he was questioned about that. He's like, "Why are you calling it that? People aren't going to understand what that means. They're not, you should pick something different." And he said, "No, like that's the name, like that because it explains exactly what it is." Now, to the conventional medical physician, functional means it's in your head. So you have a functional GI condition, irritable bowel syndrome. You have a functional neurologic disorder, like it's in your head. You're just anxious, you're just stressed, you're just whatever. Because we haven't found a test to confirm it. There's no strict criteria by which to define it. And so therefore, you got labeled as it being a functional disorder. That was saying you're anxious, you're just stressed, you don't actually have a disease process. But then suddenly, miraculously, we find a test that says, oh my God, this is the cause of this, right? So now like 60% of IBS is like, oh, you have SIBO. We're going to put you on rifaximin, a $1,500 antibiotic, and we're going to treat that, and you feel better. It's like, oh, suddenly you don't have IBS, you have SIBO. But haven't they always had SIBO? Wasn't that always, they just didn't know how to identify it, they didn't know how to find it. It wasn't in the GI literature, in the gastroenterology literature, but it was in the functional medicine literature. It was in the functional medicine studies and things that were being done already. And so when Jeff defined functional medicine and created the field, I believe back in the mid-1980s, he was defining what happens at the cellular level. Organelle function, nuclear function, cellular communication function, which leads to organ function, which leads to systems function, which ultimately leads to function, right? It defined it perfectly. It even goes into subcellular and subatomic to the individual particles that impact how the larger particles work. Well, isn't that all metabolism? Isn't that all metabolic? So is not functional and metabolic essentially communicating the same thing? Functional is describing the function, the functionality of it. The metabolic processes create the function. It's almost synonymous.
But you understand that as a functional, or rather integrative provider, with
right?
Also being in conventional medicine, and that's a
right.
very, it's a good breakdown as to maybe where functional medicine derived, because many still to this day are not clear about the difference of functional versus integrative, let alone functional versus conventional medicine. So they don't know what to ask. Patients don't know.
Yes.
And if I may, it's the intent is to pay it forward for people to be their own patient advocate and take responsibility and know what to ask their doctor. If they're going to an integrative medicine doctor such as yourself for the first time, and they have 3 focus areas that they want to work on. They feel completely stressed and burnout, anxiety, can't sleep. Yes, weight generally falls in line with that. As always, we want to have an optimal weight. But then the GI tract is affected, which can be gastrointestinal GI dysbiosis, let's say. So, and then we follow of the mental health that comes into play, where they're like, is there something wrong with me? Or you're saying functional medicine or function in conventional medicine may be in their head because they can't associate it with a test or they can't associate it, they can't determine what it is. So you, as an integrative provider, how would you start addressing mental health, burnout, stress, and GI issues? Where do you start?
Okay. So it all starts with the patient's story. Every bit of it. And this I learned from IFM. Now, I learned this in medical school. History is 90%. I learned that in medical school 30 plus years ago. And yet that is a lost art. You go in for your conventional medical visit, for your first appointment. You do get a 30-minute appointment usually, for a new patient visit in a conventional medical office. And those 30 minutes are either spent going over this one-page intake form that it has your allergies, your medications, any medical conditions you've been diagnosed with, your family history. Right? And it's basically, going through the checks, almost like going for a massage, right? You have to complete that checklist before massage because they want to make sure you're not like on a blood thinner before they do deep tissue, right? And do you have any injuries, or something like that they don't want to rub into? So it's like, okay, I see this list here. Okay. And what are your concerns today? And what are and it's very, very pigeonholed, very specific. Well, I'm just looking to establish care. Okay, great. And so we're going to start off by getting you on the scale, and we're going to get your blood pressure. We're going to get your height and your weight. And, I've reviewed your medication list and these look fine. And we're going to continue you on these, blah, blah, blah. And the conclusion of that 30-minute visit is basically there's a very brief intake and never going into any deep discussion on when things started, what their diet looks like, what their activity levels look like, how are they sleeping, nothing. Unless they come in and the complaint is, yeah, doc, I can't sleep. I'm up until midnight and then I go to finally fall asleep. And then at 3 o'clock in the morning, I'm up and awake. And it's like, oh, let's put you on Ambien. Let's put you on Lunesta. Let's get you on, medication to help you with your sleep. Sleep is important. Here's a prescription drug for it. Or try some sleep aids. Let's start with some sleep aids, that are not controlled substances, like, Benadryl sleep or something. And that's the immediate response. It's like, okay, let's address what you're concerned about. But the concern is immediately addressed pharmaceutically because the appointment never goes beyond that. Our initial appointments are generally between 75 and 90 minutes long. Our intake forms add up to over 30 pages. We review all of those 30 pages before the initial appointment. Mm-hmm. We go in knowing the patient's story. We already, and yes, I was trained this way through IFM. And that is the functional medicine approach, the true traditional functional medicine approach. Obviously, there's different people that practice it in different ways. But within our questionnaire, there's questions about childhood. What was your childhood like? Oh, actually, there's questions about birth. Were you C-section or were you vaginal delivery? Were you full term, preterm, post-term? Were there any complications, right? How was your microbiome starting? How did your life start coming into this world? Then we go into childhood history. What conditions were you diagnosed with in childhood? Did you have a lot of friends? Did you have good social interaction? Were there any traumas? How was your relationship with your family? Were you exposed to any kind of major issues that actually could contribute to why you started feeling the way you did and developed the conditions you did in your teenage years that led to conditions and the way you're feeling in your 20s and 30s and 40s? And so that longitudinal history, that timeline, has a huge impact on the patient's story. So this week, I just saw a woman that came in who has several concerns that we're addressing, including sleep issues, energy issues, and really the big complaint is dizziness, lightheadedness. Mm-hmm. And it kind of comes out of the blue. It's not all the time. It's very situational. And in obtaining the history, in talking to her about the story and getting to, okay, when did this start? What preceded it? And what was going on around the time that you first noticed this? And we got into a history of like, okay, she was an athlete. She sustained a lot of concussions, from dating back to childhood, which then says, okay, maybe this is a post-concussive type thing. Maybe this is a repeat injury scenario where something was triggered in the brain that may be contributing to dizziness. But as the story kind of evolved, and I started asking a few more questions, like, okay, is this dizziness vertigo or is this dizziness lightheadedness? Because that's a very key distinction. And it's an off-balance sensation, but there's no spinning. It really is a feeling like she's going to pass out. Mm-hmm. That's a very different symptom. That's not vestibular. That's not the back portion of the brain. That's not the inner ear. That suggests something else. So then we start talking about other things like, blood pressure. And I said, oh yeah, I've had evaluations. I went to a cardiologist that did the tilt table test. And she went to this other neurologist who had her, a functional neurologist who had her stand, sit, lie down and all that, and told her, oh yeah, your blood pressures are like all over the place. I said, did they ever talk to you about POTS syndrome? She's like, what? I've never heard that before. So I defined what POTS is, which is postural orthostatic tachycardia syndrome. I said, it's a dysautonomia. I mean, ultimately, that's the bottom line. It's a dysautonomic condition. It's a disruption of the autonomic nervous system, most commonly mediated by a big stress event, strongly correlated with a PTSD-like scenario. So that led into the discussion about her childhood and her abusive father that created the scenario, that led to the marrying of an abusive husband that immediately preceded very negative interactions, very tense things going on that immediately preceded the onset of her conditions about 2 decades ago. And she's been through the rigmarole since of going to multitudes of specialists, all kinds of experts. Not a single one of them came to this conclusion because not a single one of them asked the right question. That's from the history. She's had negative MRIs, she's had negative cardiology evaluations, she's had negative neurology evaluations, she's had negative workups of everything. And they just throw labels at her and have thrown drugs at her without accomplishing anything to actually see improvement. And yet, her abuse history and the psychological impact, which is the HPA axis dysregulation, is ultimately one of the greatest contributors to what is called POTS syndrome. But then what happens after that? Well, it's all the spiraling of everything else. So I remember this one slide that Dr. Mark Hyman used on at the IFMCP back in 2013, which was a picture of a spider web, and how our physiology, our biology is like a spider web. What touches one end affects every strand everywhere on that web. So what happens if you're chronically stressed, always in fight or flight? Well, your sleep starts getting worse. You start experiencing anxiety. Maybe you experience depression. You may start experiencing weight gain. You may start putting on abdominal fat. You may start developing high blood pressure. You may start developing, palpitations and irregular heart rhythms. And it's like, this is all downstream effects of the inciting event, of what triggered the activation of this condition. Everything else is now muddy waters. Everything else has been a worsening of the underlying imbalances in the body. And so it becomes very hard to define. In conventional medicine, we try and pigeonhole everything into silos. Oh, this is a neurologic problem. You need to go see a neurologist. Oh, this is a GI problem. You need to go see GI. Oh, this is a cardiology problem. You need to go see cardiology. And all of them just look at their little piece of the pie. They all run the little tests that they have to evaluate that particular portion of it. But no one sees the bigger picture. No one's actually pulling back 30,000 feet and saying, wait a minute, this is all one thing. This is all stemming from one underlying process, which, by the way, may have 100, 1,000, 2,000, different moving parts now, because it's evolved, it's snowballed from this tiny little nothing into an avalanche because of how it's progressed without ever being managed and addressed appropriately to begin with.
And you got
what's that?
You got this from history, because you did your due diligence from a 30-page history and didn't run a test. You didn't.
No testing has been performed yet. No. That was the initial consultation. Now we are running some tests. So we're running some functional labs, and we're running some conventional LabCorp, type blood work. And I've got an appointment, and we're going to go over those results. But I mean, ultimately, diseases develop from the dysfunction. So is she pre-diabetic or diabetic as a result of chronic, long-term, sustained adrenal axis dysfunction and cortisol dysregulation? Does she have any kind of chronic kidney disease or developing kidney disease as a result of that? Does she have liver inflammation and fatty liver disease as a result of any long-term sustained insulin resistance? Does she have, nutrient deficiencies like vitamin D or B vitamins and magnesium from long-term sustained wear and tear of just constant fight or flight? So now the labs are attempting to identify, is there something that we need to specifically address and target? Mm-hmm. Because the imbalances ultimately lead to abnormalities. And then we're doing some functional laboratory testing addressing root causes of mitochondrial dysfunction, root causes of, let's say, dysbiosis. And because chronic stress leads to microbiome imbalances, chronic stress contributes to leaky gut, chronic stress contributes to poor digestion. It contributes to less efficiency of pancreatic function and things. And so that testing will now say, look, in order to get you feeling better, in order to move the needle and improvement, we now need to start putting out these 100 different fires that have developed from that one spark. Mm-hmm. But that one spark started it all. But we can't go back and fix the spark. We can't go back and change that onset. But we have to address what's in front of us. The sooner we catch something, the more rapidly you can modify it and actually alter that course. For example, if I take someone who has a fasting blood sugar of 101 and hemoglobin A1C of 5.7%, and say, this is pre-diabetic, right? That meets criteria for pre-diabetes, and we act on that. That's so much more easily reversible than somebody that has a fasting blood sugar of 180 and a hemoglobin A1C of 8%. Mm-hmm. That's just a longer path backward. It's not that it's irreversible. It's not that it can't still be corrected without having to go down the path of medications, but it is going to be a longer path. This is not going to be, in 3 months, your labs are going to be totally normal. It may be in 1 or 2 years, your labs may be looking a heck of a lot better. So it's not this simple, you have this condition, this is how we treat it. Your TSH is high, here's levothyroxine. your cholesterol is high, here's a statin. Your blood sugar is high, here's metformin. That is a conventional medical approach based on an initial 30-minute intake consultation, and then 15-minute, which really means 7 to 8 minutes with the provider, with the doctor, appointments. Mm-hmm. How much can you possibly accomplish outside of saying, hello, it's good to see you again. I've looked at your labs. Here's your prescription update. Like, how much can you accomplish in 7 minutes unless you're from New Jersey and speak like me? So, right? And so, not a lot. And there's certainly not a lot of time in those 7 or 8 minutes for the patient to ever even speak. Mm-hmm. What can the patient possibly communicate in those 7 or 8 minutes? Not a lot. One complaint, which is often your conventional medical visit anyway. One complaint. It's what you're here for. So functional medicine is excellent in the model, in the approach. That's very different than getting into the different realm of functional medicine providers that are out there and the different modes of administration of it. So the video you shared with me with Dr. Andrew Wyatt, mm-hmm. being essentially critical of functional medicine and the distinctions. I agree 100% wholeheartedly with what he communicated in that little video snippet, because it's true. Functional medicine is not formalized. Functional medicine does not have boundaries. It doesn't have structure. You can do whatever the heck you want. Functional medicine, you could be a homeopath, you could be a naturopath, you can be a chiropractor, you can be, a health coach, and certain programs like, I'm not going to name them because that's probably not appropriate, but certain programs, basically, they just set you out into the wild. You can interpret labs. You can tell people what to do. You have no medical training whatsoever. You have as much medical training as my high school son. And you're out there giving medical advice and interpreting labs under whose authority? But there's no regulation over it. Mm-hmm. And so they're allowed to go out and do this and claim themselves as being certified, and they can make all kinds of fancy claims of what they're able to do and what they can help you with, and they have zero medical training. So that's what Dr. Weil's referring to. Mm-hmm. And then all these packages, thousands and thousands of dollar packages. You get all these labs, which he referred to, over-relying on all of these labs, many that are not even validated, or certainly at least not necessary. Mm-hmm. I did not do a single test on this woman to come to the conclusion of what she has going on. I could already move forward with a plan, a strategy, and we already did. So for this specific lady, I've already referred her to a colleague of mine who is she's a therapist who specializes in PTSD and can incorporate things like EMDR that can have a huge impact on this woman's life. Mm-hmm. There are going to be things that I have to address that she cannot, which is going to be targeted supplementation, dietary modification, all these other things that we may need to do based on what her labs now come back showing. All the fires that are started from the one spark. That's my job. But I'm not a therapist. So I needed to refer her, and I already did. And she's already getting scheduled with her, and will probably, be scheduled for around the same time that I'm going to be having my follow-up with her to go over her results. So that all came out of the history, mm-hmm. the patient's story. It tells you what you need to know. Specifics require labs. But does that mean every patient needs to have a comprehensive stool test, plus a big hormone panel, plus a big nutrient panel, plus, toxin panel, does every patient need that? Does everybody need the $6,000 package? No, absolutely not. Mm-hmm. How did we even come to the conclusion that those tests were necessary? Well, this is the package I would recommend. How do you know I need those tests? You haven't even really asked anything, to get to the conclusion that I need all of those tests. That's not personalized. Let's stop calling it that. Because we throw that word around in the functional medicine field. Oh, it's personalized. We're personalized. That package is personalized? Isn't that the same package you just offered the person that was here before me? Mm-hmm. That doesn't sound very personalized to me. Here's the bucket of supplements we start all of our patients on when you first come in. I need that. Everybody needs that. What's personalized about that? What's precise about that? Precision. There's nothing precise about that. So there's the breakdown. There's pure functional medicine, the way that it was originally founded, the way that it was started. And there is what it has become. Packages, schemes, master classes. I love master classes. Mm-hmm. I saw somebody post something yesterday. There was some thread on Facebook that I saw that somebody tagged me in as a recommendation to see me. And it was this one woman commented, I like to watch, at least a video, one of these master classes by somebody to see whether or not this is a provider I even want to go see or not, if they even know what they're talking about or not. And these master classes are money schemes. Mm-hmm. You pay anywhere from $1,000 to $10,000 for these master classes. What exactly is personalized about a master class? Other than providing these videos for people to watch and say, "Ooh, I can do this for me." You might as well watch a podcast. You might as well turn on Joe Rogan. So, because you're going to get the same level of personalized information. Mm-hmm. So this is the information that's out there. This is what people are seeking. I actually laughed out loud when I read that comment. It's like, oh, I like to watch a master class to see if the doctor. There are people who call our office and say, I'd like to schedule an appointment with a doctor and meet with him to see if I think he would be a good fit for me. We don't do that. Mm-hmm. So I don't have the time in my schedule to give you a free appointment with me for you to see if you like me or not. It doesn't work that way. Roll the dice. I've paid for very many bad massages that I left and think, I just paid for that? What am I going to go back and say, hey, I felt like you barely touched me. What was that, a Reiki session? Come on, give me my money back. Like, no.
Well,
So
what I hear in this case scenario, this study, was that you as an integrated provider, a DO, were able to actually have precise personal direction in working with this particular patient from the history, yes, without them going into any tests, but also, more importantly, where many are inquiring about how a provider can help their mental health, how they can support their mental health, meaning,
well, absolutely,
many don't know what to ask or how you specifically could guide that. And you basically just
correct,
shared how you went through the 30 years and tied it, yes, through.
Right. How did I, as a non-psychologist, non-psychiatrist, non-therapist, non-licensed social worker, come to the conclusion that I came to? Which, by the way, POTS is a cardiology, neurology, no one really knows. But POTS is a specialized diagnosis, right? So postural, well, I guess that could be neurology or cardiology, but it's definitely not GI, and it's definitely not dermatology, right? Orthostatic, so that's vital signs. That is going to be, you develop symptoms when you change positions. Well, that could be cardiology or neurology. Tachycardia, well, that's heart. That's rapid heart rate, all right? That's definitely cardiology. Syndrome, we have no idea what's causing it, all right? So I came to the conclusion that she would meet criteria for POTS with what she's describing, just the story she's told me. Mm-hmm. To me, that means dysautonomia. It's an autonomic nervous system dysregulation. That's where we jump. It's not about the diagnosis. It's not about the label. It's not about the descriptive ICD-10 code that we provide to everybody, which is nothing but a description of symptoms or abnormal labs. That is every diagnosis essentially out there. It does not define cause. It does not define how it started. It does not really even give you direction on how to treat it. It just simply describes a symptom, a condition, or a lab abnormality. And if you were to think through that and think through every diagnosis you've ever heard, what diagnosis tells you what's causing it? Not a one. But yet that's conventional medicine. Conventional medicine, insurance-based medicine, is completely reliant on ICD-10 codes to justify treatments, laboratory testing, and how we basically address the patient. And all it is a descriptor. You have fibromyalgia. What the heck does that mean? You have hypertension, high blood pressure. Wow, thanks, Sherlock. Like, okay, what caused it? You have diabetes mellitus, which is basically honey-flavored urine with frequent urination. I think we talked about this, at our first session, right? All these diagnoses are descriptors. Doesn't tell you how you got there. Doesn't tell you what caused it. Mm-hmm. And yet, in my conversation just a few minutes ago, I talked about how testing her for prediabetes or diabetes, because long-term chronic sustained stress and cortisol dysregulation can make you diabetic. Oh, wait, isn't that a diet problem? No, it's a metabolic problem. Ultimately, it is a functional problem, organ dysfunction, right? And so both, whether it's metabolic medicine or functional medicine, really work very hand in hand. Who cares what you call it, right? These are titles. Who cares what you call it? Mm-hmm. What matters is knowledge. Mm-hmm. What matters is understanding how to get there. Who cares what you call it? What profession you're working under, technically? And yes, so for me, I'm integrative because I am both a traditionally trained physician and board certified physician, and trained and have certifications in alternative medicine, which is functional medicine. So I am an integrative medical specialist. That would be the umbrella under which I then have metabolic health certification, functional medicine certification. I have my board certification through the American Board of Emergency Medicine. I have my certifications. Hopefully in the near future, I'll have another certification through FAAEM. I just got to get on top of actually completing that part. So what do all these certifications mean? Just extra training, extra knowledge, extra experience. That's all they mean. They don't make me smarter. They don't mean that I know how to do something better. They don't make me smarter than the next guy in the room. And so, but it's a title. It is a descriptor, right? So I carry a title of doctor. I carry a title of physician. But yet, what does that really mean? I know a lot of doctors who are really kind of mediocre and that I wouldn't send my family to. And I know other doctors that are brilliant and phenomenal, and they're, they are truly, amazing. And the title itself means absolutely nothing. The running joke, I first heard this in medical school, and, it holds true to today. What do you call a person that graduates from medical school with a C? Doctor.
Okay. I didn't know you were going to go with that.
Well, does it really matter? You graduated. Mm-hmm. Congratulations. Mm-hmm. Oh, you've got a certification. You get to carry this title now. It doesn't matter what your baseline knowledge is. It doesn't matter how intelligent you are. It doesn't matter what level of experience you have, what you've treated, how you address things. What matters is you were smart enough to pass a test and you got a certification. Mm-hmm. Congratulations. So, but now you get to hang that shingle. You get to put out these claims. You get to say that you got this credential, that you're able to run with and use. That doesn't make you a good physician. That doesn't make you a good clinician. It just gives you a title. So you as a health coach, you're probably familiar with some other health coaches. Not all health coaches are the same. You can graduate from the same program, get the same certification, and you could be the absolute most outstanding health coach in the world, and you're incredibly personable and interactive, mm-hmm. and incorporate kind of a big world view into how you address your clients. Or you could be a toadstool that can barely motivate a person to even make a single change. But hey, you've got the same certification. Mm-hmm. And you get to put yourself out there as, I'm a certified health coach.
Yes.
It's no different in medicine. And so again, these labels, I have no interest, no desire. I don't go into my appointments to say, I'm a metabolic health expert. I can fix this for you. I'm a functional medicine specialist. I can fix this for you. I never communicate that. Mm-hmm. That's on my business cards. That's on our website. So that, for people who are, I'm looking for a functional medicine specialist. I'm looking for a metabolic medicine specialist. I'm looking for a DO, all right? Like, I want a DO because DOs are more holistic. No, that's not true. Absolutely not true. We were trained more holistically, but you know what? I know I've got DO colleagues, neurosurgeons. Guess what? They're not holistic neurosurgeons. Let me hum over your brain while I'm removing this brain tumor and spread positive thoughts into no, not a holistic brain surgeon. I promise you that. My DO cardiology colleagues are not talking about, hey, so while I'm putting in this heart stent here, while I'm doing this procedure, let's talk about your stress levels recently. And no, not more holistic, incredibly skilled, highly, trained in what they do and excellent at their jobs, mm-hmm. but not more holistic than their MD counterparts. They're doing the same job with the same level of skill and could be better, could be comparable, could be not, but that's what they do. There's nothing holistic about that. Mm-hmm. So the holistic is what you choose to do separately. It is to, and we're actually creating a little bit of a differentiation post that we've got coming up on our social media here soon, but, differentiating between the allopathically, osteopathically trained physicians, in functional medicine versus the complementary and alternative practices in functional medicine and the distinctions between them. Mm-hmm. Well, only we can prescribe medication. So if you have something that would benefit from medication, we can do that. Complementary and alternative cannot. Mm-hmm. We know the standard testing and procedures by which to refer to a specialist because we recognize the presence of that and the benefit in a chronically diseased society of who may actually need a heart stent or a valve replacement, or, you know, understanding and recognizing the pathology that's there that may benefit from that specialist in conventional medicine.